just called Japan.
And when you talk about what people don't tell you, or side effects that come about, Kim even noticed this too, because when she had the stroke,
Try not to touch the screen.
she had some trouble with memory and talking and speaking, particularly walking. And it seemed like after the treatment, my wife and I noticed that she was walking more. She was using the walker for a while, and then a cane. Started out, the little scooter, little scooter she had. To the point now where she wasn't using the scooter, she wasn't using the cane, and Kim even noticed that her cognitive thinking, her conversation, her talking.
When she'd come in, I'd be talking to her, and she'd just repeat the same thing. Boy, I got to get my son's got to get one of these, and 30 seconds later, my son's got to get one. She would just keep repeating herself, and that stopped. I mean, I didn't notice that at all the last time or two she was in, and she just seemed brighter and more with it.
Her thinking's better, her walking's better, her gait's better.
She was in therapy, and I was the one taking her to therapy, and the therapist said to me, "This is going to take at least 6 months to a year." So I thought, oh Lord, here we go, So we had maybe, 2 months of therapy, and they stopped her therapy. She was on the walker at that time. And so then we switched to the cane, and I was a little leery because, like I said, she's got broken arms, and she's got her broken foot. I mean, she's been through a lot. I've always been her caregiver, so I said, no, Lord, please, no more. Well, since then, she's off the cane, and I see her right here, take your cane today, and she says, no, I think I'm all right without it. And we were out shopping the other day, and she was ahead of us. And he says, look at her. She's about running, And he says, Sandy, do you realize, you have no cane, and you're ahead of us? And she says, oh yeah, but if I do too much, my leg bothers me. I says, well, my leg bothers me too if I do too much. But so I contributed all to.
She's done amazing. I'm a newkie. I just got this thing Wednesday, but we've been talking to people for the past couple months. In fact, I was going to talk to Jim about this and how they kind of backwarded my machine. I was a bit uptight because of the pace of waiting for this thing. So speed that off a little bit, Jim. Try to get it, get it out a little faster. But we've been obviously previewing this thing with a lot of our patients and getting them excited about it. And one gal in particular, she's told she'd had to have surgery on her knee. She'd been searching, but didn't do any chiropractic adjustment. Wasn't helping the knee too much. She went out and did a laser therapy with this. Another, I won't mention the name, but kind of sucked her into so many treatments, X amount of dollars, $2,000, X amount of treatment. Going to heal your knee, no problem, no pain, none whatsoever. She came to us about a month ago. I said, how's your treatment going? And she said, well, I'm not very happy. She said, I'm down to maybe a 5 after $2,000 worth of treatment. I said, well, we're going to get this machine, and I swear it's hopefully going to help you. I didn't want to put too much pressure on it. I said, hope it's going to help you. She came in yesterday?
Yeah, we just got our machine Wednesday afternoon.
She came in yesterday.
And we're closed Thursday, so she was there.
She's so excited. Put the treatment on her knee. And kind of new with this, doing different things with the knee. Did a butterfly on her, kind of moved around a couple, 2 or 3 different times. And just in conversation, talking about it. And I think I put on about 3 different times, about 9 minutes. She got up. She's walking around like this, moving her leg, walking. Oh my gosh, I can't believe it. No pain whatsoever. And she started walking, she told me, she said, this is amazing. I spent all that money getting rid of laser therapy, and she said, this is the greatest thing. She's so excited. She said, can I start telling people about this? I said, yeah, I start talking about this.
Give me a week first.
Give me a week first. Can I tell people about this? I have a sister that has a fasciitis in her foot, and she already got so many people lined up to come see us. That's amazing.
Kim actually called me, and I was in Arizona visiting my son and daughter-in-law and their new grandbaby, and because Joe was talking to him about getting one of these machines and wanted to get my opinion, and we've just seen some amazing things, which I'm sure any of you who've been using this have seen this as well. But I have a patient who was in a serious auto accident 20 years ago. Kid head-on by a man who had a heart attack and busted up the entire left side of her body. And I've been treating her ever since. The auto insurance has paid for her care all these years. And she comes in on an as-needed basis, which is very frequent, 2 or 3 times a week, because chiropractic care has only given her partial temporary relief, which never lasts. And the relief has been minimal, but it's the only relief that she's ever experienced with anything. So I suggested to her that we try pulsing her once we start using this equipment. She now comes in on the average of once every 2 weeks. Her pain level has gone down sometimes to absolutely nothing, and often reports at worst a 4 or 5, where before it was always an 8 or a 9. And her frequency of care has diminished significantly. So I actually wrote her insurance company and said, look at her records. This is, you can see the frequency of care over the years. You can see the pain level that she's been reporting. And she loves this. It's helped her so much. And for somebody who's just suffered 24/7 for 20-some years, to get even half the pain level, much less at times, she reports, I can't believe it, I feel fabulous. I can cook in the kitchen, I can do things, and not have pain where before, if I did anything off for very long, I suffered miserably. So it's exciting to, as Kim said earlier, we all became chiropractors to help people who are suffering, and now we have a tool that we can help patients with that, as much as we believe in and love chiropractic care, an adjustment was not going to do that. So it's fun.
But recently I had a 13, that was supposedly turned off. Put the machine on this way.
Doesn't know how to shut it off.
And the mom had been having some difficulty with behavior and learning problems. So I had him read out loud and muscle tested him. I do applied kinesiology. And then I had him read backwards and muscle tested him, and he was strong. So then I did the machine on him, and then I had him read. First of all, he read out loud much better. His mother was like, I can't believe this, you know, he's just very clean and clear. And this was literature, just something I grabbed off the shelf, just read this. And he was just rifling right through it before he was having a difficult time going either direction. But he was actually stronger right to left. I think some people are wired that way. But anyway, after doing the machine, he definitely was running much smoother. He was also enjoying it. He was terrified about coming in because he didn't want to be adjusted. He didn't want that high velocity cervical stuff. And I'd done some osteopathic cranial on him and kind of loosened the whole situation up. Prior to that, years ago, I gave him cross crawl patterns, kind of you know, define the neurological development and stuff like that. He wouldn't do them. You know, but this thing, he's wired. He's happy.
One question, Dr.
Yeah.
Snoopy's, how did you treat him, and what did you use as far as the...
Well, I'm not as creative as a lot of these guys. I'm going to be changing some of my stuff, but I just put the butterfly in his head and go different directions. Right after I got my machine, Emery was telling all kinds of people about this up north, and I was up north on a weekend, and people were asking me about it. And that's back in December. I said, geez, I just got this thing. And so somebody said, well, is it good for macular degeneration? I said, it's supposed to be. And he read the, you know, just here, open the box. And I said, it's supposed to be. It won't do you any harm. She said, would you mind treating me? And she owns a local coffee shop in Harbor Springs. And as I was treating her, her vision improved. And I go, well, that's pretty out there. So I started going
As you were treating her?
Yeah. And I mean, I was as surprised as you are and she was. And so I started going up there more frequently because I just wanted to see if this was a fluke. And she would call me in the middle of the week going, I just saw dust. And I said, well, get your house clean. But she hadn't seen individual snowflakes in a long time. And she had gets to be a long story because she had meningioma wrapped around her optic nerve, and she went blind during a surgical procedure on one side, and she was terrified to get the yearly MRIs that they told her to get. So she didn't. And so for 12 years, in that last year before she asked me to treat her, she started losing the vision in her good eye. So her vision came back. She called me up and said, I just read 3 newspaper articles. Well, then she got the nerve up to get the MRI, and a well-meaning neurologist friend of hers said, stop everything, because you want to get your MRI and have it be the worst-case scenario. Well, sure enough, you had a meningioma around the good eye. And so I don't know what we were doing, if we were enhancing optic nerve function or receding, working on the tumor itself, or both probably. But she went through fractional radiation. All this took 3 months. She was off the machine. And finally they said, okay, you can do whatever you want now. So now she's back on it. She's reading it. So pretty exciting. Cool.
It was about 2 years ago. It was 2 years ago in March when I got a phone call from my son. And I'll never forget, he said, Dad, I'm having some trouble breathing. Can I meet you at the office? Will you adjust me? I said, sure. So I met him at the office. I adjusted him. I'm thinking bronchitis. I loaded him up a bunch of supplements. I said, if you're not feeling better in a few days, give me a call. 2 or 3 days later, he called up and at dinner with Peggy and my brother-in-law and sister-in-law, and he calls up. He said, Dad, I haven't even left the room all day. He said, I can't even talk on the phone without losing my breath. I said, well, you got to get in and get evaluated. So he went to, had a guy that worked for him taking the U of M hospital. They did x-rays. They said, you got any family nearby? He said, sure. He said, well, we want to do a CAT scan. Why don't you have them come out and visit with you? It's going to take a while. So we went out there to the hospital. He's joking, having a good old time. And they did the CAT scan. We went back, and that's when they told him that he had a huge tumor in the center of his chest. He had 3 other tumors down below. It was stage 4 lymphoma. Yeah, poor kid, there wasn't a chance really at that point. But I started looking everywhere I could to find something that would help. And I found this website, GordonResearch.com. And I started watching the videos. And it was Dr. Gordon. And it was something about the way he explained things that just resonated with me. I knew that this guy knew what he was talking about, and I should learn more. So, well, when Ben passed, actually July of 2 years ago, it took a while to get it kind of back to normal, if you ever can get back to normal. And I think it was in December 2011. Dr. Gordon, he started talking about PEMF. And all this stuff he was saying started making sense to me. It started getting me really interested. So one day, I'm looking at the PEMF website, and I see I got the picture of the machine there. And Jay, hello everyone, who was Ben's best buddy, never left his side for 4 months. He comes in the office, and we're sitting there talking, and he looks over at the screen. He says, hey, that's what they used on Ben. Now, after the medics gave up on Ben, he went to see a doc in Ann Arbor who does a lot of alternative stuff, a lot of IV stuff. The first thing this doc did was send him to Toledo to see Dr. Roberts. Right? So Dr. Roberts, is a cardiologist down in Toledo, has this big 10,000-pound static magnet. Ben was supposed to go down there, spend 200 hours underneath this magnet, and it would just shrink his tumor. Well, Jay takes him down there to spend the night, but the only way that he could use this thing, because it was so heavy you couldn't turn it, was he'd have to lay down, lay supine. Well, when he laid down, the tumor mass was so big and he had so much fluid in there that it would just compress everything. And he was so uncomfortable he couldn't do it. Well, that's all I remembered, was that he couldn't do it. So Jay says, that's what they used on Ben. I said, I thought they used this big magnet and he couldn't do it. He said, yeah, they couldn't do it. Well, they set him in a chair and they wheeled this machine in like this. And they wrapped this rope thing around his chest and they turned it on and he started breathing normal, went right to sleep. Well, Ben could never sleep. He just was so uncomfortable, he could never sleep. He said it was the coolest thing I've ever seen. And then he said, they came in after an hour or so, wanted to take it away, and I wouldn't let him. Jay's big boy. But, so I started realizing that I really didn't have a choice about getting involved with PEMF. I was being kind of led by somebody, and I knew who it was. So I got my machine, how I got my machine's kind of a different story. I don't want to share with you now, maybe some other time, but I got my machine. I started treating myself, I started treating my head, and I gotta tell you, I was pretty depressed at that point. After first or second treatment, it was like that lifted. That feeling that I couldn't put one foot in front of the other just went away. And I started feeling like, hey, I can do things. Patients I started treating started saying, I can't believe how much better I'm feeling. Some of you have seen the picture, who's seen the picture of the guy with the radiation damage? Have you all seen that? Yeah. That was one of my first patients I treated. He'd been a patient of mine forever. Parotid cancer, they did surgery, radiation therapy, this big wound that wouldn't heal for 4 years. I said, you know, this thing's supposed to help healing. You want to try it? He said, sure, anything. So he puts it up on his face, or we put it up on his face, and heck, within 3 treatments, 12 days, the thing starts healing up for the first time in 4 years. So I knew we were onto something. So one thing has led to another. Now we have 3 machines in the practice. We're helping a lot of people. It's changed my life. It's changed the lives of many patients. And the neatest thing is, not only we've changed the lives of the patients in my office, I've got a lot of friends out here that have got machines, and they're changing the lives of patients in their office.